Sandra Pearson knows the pain and frustration of delayed discharge.
My sister and I were in tears on more than one occasion. It's heartbreaking, absolutely heartbreaking.
Her mother, Ava, who has dementia, was ready to leave hospital 9 days after a fall. But it was a further 96 before she was able to leave.
When we were eventually able to go in, it was such a shock. We just couldn't believe how Mum looked. She lost over 2 stone in weight in the time that she was there. But also her personality had changed. We found several care homes that she could have gone to, but they didn't act upon it quickly enough. And by the time they did, Mum's behaviour had deteriorated, so they wouldn't take her.
It's an issue the PM says he's determined to sort.
The number one problem we've got at the moment is there are around 13,000 people in hospitals who ideally should be back in their communities in social care or home settings. And recently we've put an extra £500 million in over this winter in a discharge fund.
The government are now expected to spend hundreds of millions of pounds block buying care home beds. And if it all goes to plan, some claim the effects could be felt within weeks.
I've been working in A&E for the last 22 years and I've never seen anything like this.
While this emergency medicine consultant welcomes more investment, he argues the alternative is unnecessary deaths.
We need a solution immediately. We need this to be reviewed as a crisis and the NHS put in a crisis footing, because we know that for every 82 patients who wait more than 6 to 8 hours in A&E waiting for a ward bed, an extra patient dies within 30 days. And this is a preventable death. And if we're not going to sort this out, an unnecessary 300 to 500 people every single week will die in English hospitals because of these delays in emergency care.
The health service is not just on its knees, it's on its face.
Meanwhile, Labour concede if they get into power, private companies will play a part.
So more use of the private sector in the NHS under Labour?
Yes, but I mean, let me be clear, we're not talking about privatising the NHS, we're talking about using the private sector effectively. And free at the point of use is an absolutely governing principle as we go into this review. But we do need change and reform.
But pay and conditions remain the most pressing problem for the NHS. Tomorrow, as Steve Barclay meets health unions, doctors will be balloted on industrial action and ambulance workers are due to strike later in the week. Joe Pike, Sky News, Westminster.